Welcome to this one-chart video tutorial on how to properly record a pain medication follow-up assessment. Today, we will go over recording all of the proper information to ensure compliance with the DPH as well as the Joint Commission insofar as the recording of a pain medication follow-up. For the purpose of this tutorial, we will begin by having already logged into one-chart, completed our patient assignment, opened up Care Compass, and established a relationship with our patient. Additionally, we will have already performed the detailed pain assessment and recorded the administration of a PRN medication for pain, in this example, acetaminophen with codeine. We will navigate to our patient's Care Compass task list by clicking on the sideways triangle next to the patient's name, which will display a list of tasks. Immediately notice that there is a task displaying for a pain medication response. Navigate to this task and select it, and follow by clicking on the Document button. We are immediately brought to the patient's chart, where the form for medication administration follow-up is opened. Make note that the very first thing displayed is the detailed pain assessment already completed prior to the administration of the pain medication. The assessment details have automatically pulled into this form from the patient flow sheet. Next, right below the initial assessment details, you will have the opportunity to record a follow-up assessment in response to administering the pain medication. So for this tutorial, we will record that our patient states that she still has a headache, which was the reason why the pain medication was administered, but it is better and no longer aching and throbbing, but more of a dull nature now. It is important to note at this point that in the event that your patient is sleeping when you return for the follow-up assessment, it is appropriate to indicate a numeric rating of 0, and in the medication effectiveness section at the end of the form, select the Other radio button and record your details in the free text pop-up window that displays indicating that the patient is sleeping, using whatever verbiage you feel is appropriate to indicate the patient appears comfortable. After reassessing our patient, we now have the opportunity to record a new set of vital signs should the patient condition warrant this. Select the Vital Signs chapter from the left margin of the form. This now displays the Vital Signs/respiratory portion of the form. You may need to record a new set of vital signs if, for example, when you return to your patient for the follow-up, you notice that your patient appears unresponsive and is having difficulty breathing. You most likely will want to record a new set of vital signs here. Doing so from this form will automatically send the vital signs over to the flow sheet so that you don't have to leave where you are, keeping with the continuous workflow. It is worth pointing out that the vital signs recording is not a required chapter within the form. If you choose not to record a set of vital signs, you can simply select the next chapter. We will continue by selecting the Pain Assessment chapter of our Medication Administration Follow-up. Once having selected the Pain Assessment chapter, it's important to notice that once again, the details of the previously recorded pain assessment have pulled forward onto this chapter of the form. Here, we can select the type of scale we are using, and for today's tutorial, we will be using the numeric rating scale. Notice that by specifying this, the numeric form automatically opens, and here we will record that since our patient reports the medication helped, we need to record that her numeric rating is now a 2. After selecting the radio button associated with the rating value, click the Form Return button in the upper left corner so that you're returned to the follow-up form. Next, keeping this chapter open, scroll down to the Objective Behavioral Assessment section. Here, select the assessment appropriate for the patient that you are assessing based on either the patient location, age, or type. For example, if I were assessing a neonate, I would select either the NPAS or the NIPS pain scales. But for the purpose of this tutorial, we'll select the PAIN-AD pain scale for dementia patients. Notice that by selecting this radio button, the appropriate form now displays to assess a patient with advanced dementia. Once complete, select the Form Return button to be returned to the assessment follow-up. Finally, the last section to complete is the medication effectiveness. This needs to be completed in conjunction with the updated numeric rating previously recorded. It is extremely important to note here that only completing this section of the form does not meet DPH or Joint Commission compliance requirements. The only way to be considered compliant is to have both a follow-up numeric rating and the medication effectiveness sections completed. Both of these pieces of documentation complete the puzzle and put us in compliance. Just recording one or the other is not enough. As previously discussed, should your patient have been asleep, this is where you would select the Other radio button, which would then display a free text box where you could indicate the details, how you assessed the patient and determined that they were no longer in pain even though you did not wish to wake them. For this example, however, I'm going to go ahead and cancel out of this, and I'm going to select the Yes response. As previously discussed, our patient reported that their pain level had dropped to a 2, indicating that the medication was effective. Once you've indicated the effectiveness, complete the process by clicking on the green Sign Form button so as to save your documentation and appropriately send the information over to the flowsheet. Upon completing the form, you are then returned to the Care Compass task list, where you now see the task has been removed as part of the documentation completion process. Had you not recorded the follow-up assessment from either the Care Compass task list or the Activities and Interventions screen within the patient's chart, you would have had to manually remove the task from your task list yourself. Using the system-generated task appropriately brings you to the right sections of the chart to record your follow-up assessment and allows the system to automatically close out the open task, keeping your task list current and meaningful. This concludes the OneChart tutorial on proper recording of a pain medication follow-up assessment.